Sociopath. How deranged individuals and criminals tend to ruin society. Written by Lucy Hiltz, John Kirschen, Matt Belster, Victor Higgins, and Taylor Hench. Narrated by Lucy Northfield, Sarah Owens, Oskar Gundersen, J.A. Lydick, and Rory Young.
Bipolar Disorder: Symptoms, Treatment, Medication, and Solutions. Written by Lucy Hiltz. Narrated by Lily Northfield. Chapter 1. Symptoms and Treatment Choices. What is bipolar disorder? Bipolar affective disorder is a brain disorder that triggers unusual shifts in mood, energy, activity levels, and the ability to perform day-to-day tasks. Signs of bipolar affective disorder are severe. They are different from the typical ups and downs that everybody goes through from time to time. Bipolar illness signs can lead to harmed relationships, poor job or school performance, and even suicide. But bipolar disorder can be treated, and those with this illness can lead full and efficient lives. Statistics. Bipolar is about a third as typical as depression, less than half as typical as attention deficit hyperactivity disorder. Diagnosed in about 2.6% of adults and 0 to 3% in youth. 48.8% receive treatment. While the rate of bipolar illness is the exact same amongst African Americans as it is among other Americans, African Americans are less likely to receive a health diagnosis and treatment. Ethnic minorities with bipolar illness are very likely to be misdiagnosed with schizophrenia, perform disorder, or antisocial behavior. APA 2012. Some factors have contributed to African Americans not getting help for bipolar illness and other mental illnesses. Some of the reasons are a mistrust of health professionals based in part on traditionally higher than average institutionalization of African Americans with mental disorder and on previous mistreatments, like such awful events as the Tuskegee syphilis research study. Cultural barriers between many doctors and their patients. Dependence on family and spiritual community rather than mental health specialists at the times of emotional distress. A tendency to discuss physical problems rather than talk about mental signs, or to mask symptoms with substance abuse or other health conditions. Socioeconomic factors which can restrict access to health and mental health care. Continued misunderstanding and stigma about mental illness. Symptoms of bipolar disorder.
Sample complete. Ready to continue?